people have known the discomfort of muscle or joint pain, whether it's from lifting a heavy object or twisting the body abruptly. Muscles and bones may get pulled from their normal positions, which can lead to discomfort and serious injury. As you care for your loved one at home, you may find yourself lifting, pushing, and pulling, especially when helping your loved one get comfortable or move from one place to another. Each time you twist your body quickly or in a way that it's not meant to twist, you can increase the chances of injuring your back. Keep your body in balance to avoid injury. This is called body mechanics. The 5 principles of good body mechanics are: use a broad base of support. Keep the object or person you're lifting close to your body. Keep your upper body straight and upright. Use momentum to help you move without jerking. And do not twist your back. Do not lift and twist, but pivot instead. Practicing good body mechanics will help protect you from injury and help you maintain good posture and strengthen your muscles. Now let's take a look at a few specific exercises. To practice standing correctly, follow these tips for improving alignment. Relax your knees so they don't lock. Put your weight evenly on both legs and stand with your feet shoulder width apart. Stand up straight with your stomach muscles tightened, buttocks tucked under, your head up, and your chin level. Align your upper body by keeping your shoulders right over your hips. To practice lifting correctly, follow these tips for improving alignment. Before lifting, stagger your feet about 12 inches apart, with one foot slightly in front of the other. This position provides a broad base of support that makes it hard for you to lose your balance or fall. Before lifting, make sure your loved one or the object you lift is close to you so that you don't strain your lower back.
Ready?
While lifting, keep your loved one or the object
1,
close to your body.
2, 3.
Keep your upper body straight. Bend your knees and stick your buttocks out. Guide smoothly without jerking. To turn, use momentum to unweight your loved one from his or her seat by rocking back and forth
1,
on your staggered feet.
2.
Pivot on your feet with momentum and make sure you do not twist your back. Lift with your legs, not your back.
There you go.
Using good body mechanics protects your back. Do not attempt to lift someone who is significantly larger or heavier than you are. This could end up hurting both of you. Arrange to have someone help you move or position your loved one. You may also want to ask your loved one's healthcare provider or physical therapist about gait or transfer belts and other assistive devices that can help you move your loved one safely. If your loved one has to spend a lot of time in bed, help him change his position often. If possible, help him get out of bed and sit in a chair as often as he can. This will help prevent pressure ulcers and stiff joints. Pressure ulcers, often called bed sores, can develop when a person stays in one position too long, which increases pressure on certain points on the body. Pressure ulcers can become very painful and serious, and it is very difficult to get the sores to heal. In people with light skin, pressure ulcers first appear as red and tender areas on the skin. With darker skin, the skin appears darker than normal. Those areas of the skin can turn into sores. They're most likely to occur on bony areas of the body, such as the shoulders, the heels, and the tailbone. To help prevent pressure ulcers from developing, keep your loved one's skin clean and dry. Check daily for changes in skin color, especially under the breasts, skin folds, and in places that touch the bed, such as heels and hips. Avoid friction when moving or positioning your loved one. You may need help to do this. Gently massage the skin around pressure areas with a circular motion. Help your loved one reposition himself every 2 hours. Keep her bed as wrinkle-free as possible. Use a padded mattress, egg crate pad, or sheepskin. Encourage him to drink plenty of fluids. And finally, provide a well-balanced diet. Encourage your loved one to get out of bed regularly. If you see any red or broken areas on the skin, notify the healthcare provider immediately. If your loved one is not able to get much exercise, encourage him or help him to do range of motion exercises. These arm, leg, and foot exercises, which can be done in bed if necessary, help prevent stiffness and soreness while improving circulation. If he is unable to do these exercises, you can help. Be sure to watch his face for signs of pain. Always keep your back straight and avoid reaching across the bed. Repeat each exercise at least 5 times. To exercise the shoulder, with one hand, hold his wrist with his thumb pointing upward and your other hand under the elbow. Keep giving him support throughout the exercise. First, raise his arm straight up and then move it to shoulder height. Lower his arm to the side.
62.
Then, move his arm out, away from the body,
Doesn't hurt at all.
and return it to his side.
You feel a little stretch?
Yeah.
Next, place your loved one's arm slightly away from the hip. Supporting the wrist and elbow, move his arm toward the hip and then away from it.
It's having a little nap.
So I know it doesn't hurt then.
That doesn't hurt it. Feels good.
Yeah.
To exercise the elbow and forearm,
Strong.
first, hold your loved one's wrist with one hand and put your other hand under the elbow.
3 good ones.
Keep supporting his arm throughout the exercise. Then, bend his arm at the elbow so that the hand moves toward the shoulder on the same side.
I want to get you
Then,
nice and strong
straighten the arm back down to the hip.
out of this bed.
Next,
Feel okay?
with his forearm at a right angle to the bed, turn the palm down toward the bed.
To hear that.
Then, turn the palm up toward the
Nice
ceiling.
and limber so that pain doesn't come back, okay? Glad to hear it.
To exercise the hip and knee, first, put one hand under your loved one's knee and your other hand under his foot.
But it's easier to
Keep
walk.
supporting his leg throughout the
Your
exercise.
leg forward a little
Then,
bit easier.
bend his knee and move it up toward his head to flex his knee and hip.
Raise. Remember these ones?
Oh, yeah.
Next, put one hand on the knee and the other supporting the ankle.
Just a little stretch.
Straighten his knee to extend his knee and hip. Lower his leg to the bed.
Well, I guess to lumber.
So, Dad, we're going to rotate your hip now.
Finally, bring the knee up toward the ceiling, cradle the foot, and support the ankle.
Turning one.
Gently rotate the hip inward and outward.
See how your knee is turning?
As always,
This one helps
repeat
you to
5
turn to get
times.
out of bed.
Oh.
Yeah. And then all of these, I'm just going to hold.
To exercise the ankle,
I know your feet are
first,
sore and
put
good.
one hand under your loved one's ankle and grasp his foot with your other hand. Keep supporting his ankle throughout the stretch. Then, push his foot toward his head and then
Hips are
downward.
all ready, Dad.
Hold for a few seconds.
Got a good long stretch.
Next, make a small circle with your loved one's toes to rotate the ankle while supporting the heel.
Can we go the other direction?
Rotate in the opposite direction.
Go. That's great.
To help your loved one maintain as much independence as possible, encourage him to do as much as he can on his own. Be there for him if he needs help, and make sure he's safe at all times. Before attempting to move him, explain what you're going to do so he can help you if possible. Work as a team. If your loved one is unable to sit up in bed on his own, you may need to help. If his bed cannot be elevated, use one of the following 2 methods. To create a backrest that raises the head and shoulders, either stack up several pillows against the headboard or wall, or insert a foam wedge pillow between your loved one's back and the headboard or wall. Before your loved one gets up and out of bed, it's a good idea for him to sit on the edge of the bed for a few minutes to get his balance and stabilize his blood pressure. Encourage him to do as much as he can on his own. Slowly and gently, help him sit up in bed. Help him scoot his body to the edge of the bed. Gently swing his legs over the side of the bed. Have your loved one stay seated for a few minutes before standing or moving to a chair or wheelchair. He may need help getting from bed to chair. Here's how you can help.
Morning, Dad.
Morning.
How you feeling?
Fantastic.
You can also use this skill to help your loved one moving in and out of the car. Place the wheelchair or stationary chair at a slight angle against the bed on the person's stronger side. Lock the bed brakes if your bed has them. Remove or fold back the wheelchair footrests. Lock the wheelchair brakes.
Dad, we got to get some slippers on you, okay?
Help your loved one put on slippers or footwear.
Want to make sure you don't slip.
Help him into a sitting position.
Does that feel okay?
With your knees bent and back straight, put one of your arms under your loved one's shoulders and the other arm on his hips.
We're ready to go.
Turn him toward you, bringing the legs to a dangling position over the side of the bed. Stay with your loved one and encourage him to sit on the side of the bed for 2 minutes.
How you feeling?
A little dizzy.
A little dizzy?
Some dizziness is common when a person sits up after being in bed for a while. If it doesn't pass, gets worse, he becomes sweaty or short of breath, or if he is in any
Is that any
pain,
better?
lay him back down.
Yeah, I'm feeling better.
Okay, you ready to go to the chair?
Yes.
Alrighty.
Securely grab his waistband. Have your loved one use his hands to push himself up if possible. Encourage your loved one to do as much as he can to help. When your loved one gets ready to move, his buttocks should be at the edge of the bed and he should be leaning slightly forward. His feet should be flat on the floor and toes pointed straight ahead. Stagger your feet by placing one foot facing him with your knee, the one farthest from the chair between his knees, and your other foot further back. Keep both feet facing your loved one. Bend your knees, tighten your abdominal and buttocks muscles, and keep your back straight. Get as close as possible in a hugging position. Position your head so you can keep the chair in sight during the move. Tell your loved one that on the count of 3,
Dad, on the count of
you're going to
3, I'm
help
gonna
him into
rock
the
you,
chair.
And we're going to go to the chair.
Rock
Ready?
back and forth gently on each count
1,
to create momentum.
2,
And on the count of 3,
3.
move him into the chair. Turn your body with your loved one as he pivots until he's right in front of the wheelchair.
Good. Great.
Tell him to reach for the arm of the chair. Lower your loved one into the
that was
chair
great.
by bending your knees and
you
keeping
feeling?
your back
Feeling
straight.
much better.
Great, good.
He can help by placing his hands on the chair arms and lower himself into the chair if possible.
Hey, that was great. 2,
Check your feet position.
3.
If pivoting correctly, you and your loved one's feet will be parallel. Moving your loved one frequently to help prevent pressure ulcers and improve circulation may mean that you have to move him from his back to his side. Follow these steps. If possible, have your loved one cross his arms over his chest and cross his ankles toward you. Put one hand on his shoulder and the other on his upper thigh and roll him toward you. The shoulder should be positioned so that he is not lying on his arm. Support his back to keep him in the proper position. Support his top arm with a pillow. Place a pillow between his legs, keeping the top leg slightly forward of the lower leg.
¿Se siente cómodo?
Your loved one may have trouble walking when she gets up. If she is unsteady, encourage her to practice standing by balancing between 2 sturdy supports. To walk with your loved one, ask her to put on a belt so there will be something for you to grip. Or grip the waistband. Grip from behind so you will not be in the way as she walks forward. If your loved one watches her feet while walking, remind her to stand up straight and hold her head high. If she is weak or afraid of falling, walk with your hands on her waist from behind or around her waist from the side to prevent her from falling. Do not let her hold tightly to your hand. Your hands must be free to quickly grasp your loved one if sudden support is needed. If she faints or starts to fall, prevent injury by easing her to the floor. Call the healthcare provider after your loved one falls. If you suspect head, neck, or back injury, call 911. Your loved one may use a cane, crutches, walker, or other device to get around. These should be adjusted for her by a professional. Using these devices may take practice and patience before your loved one feels comfortable with them. Here's how you can help her get used to a walker. Put the walker directly in front of her and help her to stand. Do not let her pull or lean on the walker, as it may fall. Ask her to put her hands on the walker's hand grips, flexing her elbows slightly. Remind her to stand upright. Have her lift or roll the walker and put it down about 6 inches forward and then step into it. Remind your loved one to walk as she would normally, looking ahead while using the walker.
Stay home, so.
Easier.
Okay, Look straight ahead.
You've learned the basics of good body mechanics and the importance of positioning and movement. Try to use the correct techniques to help your loved one move and maintain healthy muscles and joints.